Well, we've got a new president, a new plan to fight COVID-19, lots of big changes to talk about. I'm joined now by our medical expert, Dr. David Winter from Baylor Scott & White Health. Good morning to you, Dr. Winter.
Good morning, Sonia. Always good to be with you.
Likewise. Okay, so I think you and I are getting a lot of the same questions. Let's start with the top most common one. Who can get the vaccine at this point and where?
Well, it's important to emphasize the state of Texas has mandated that right now the people who should be getting the vaccine are healthcare workers, nursing home patients, folks over age 65, and younger folks with chronic medical illnesses. Now, if you're not in those categories, I know there's a lot of anxiety about that. I'd like my wife and kids to get a vaccine also, but they can't. We have to wait and do the things we know works. Masking, distancing, good hand hygiene that's worked for 12 months. When we do it right, that's working. But right now, it's only those categories right now who should be getting the vaccine, Sonia.
I know there are a lot of people in those categories who say, but I still haven't been able to get one. And then there are people who are not in those categories who have been able to get one. So how do you talk through this issue with patients?
Well, some of the folks who have gotten those that may not be in those categories got those because the vaccine goes bad after 5 days. So we have pharmacies and some of the hubs calling saying, okay, we've got so many vaccines left at the end of the day, end of the week, anyone can come in. That's smart to do that. Most folks, I think, are appropriately getting the vaccine. It's important to understand that only about 3% of all Americans have gotten the vaccine so far, so 97% of folks are waiting. We need more vaccines right now. The vaccines are gearing up. Distribution hubs are getting better. We'll get those in time. We just got to be patient, Sonia.
So, Dr. Winter, is it sort of like right place, right time if all of a sudden we got to get rid of the rest of this vaccine, or is there a wait list? Should you get on a wait list with either a pharmacy, your healthcare provider?
Yeah, I think anywhere you can get on a wait list, that's a good idea. You know, if a company has 1,000 vaccines, they may have 1,000 people sign up, but maybe not all people show up. That's what we're seeing right now, some places that I've heard. And then those last 5 or 10 vaccines, they want to give those away. So they'll call you up if you're on a wait list. So anywhere you can get on a wait list, you should get on one. The vaccines are equally good and they're both great. So anywhere you can get one, I would recommend that.
Okay. Now, another question, sort of, another topic, I guess. If exposed to COVID, should I get a test? What kind of test? When should I get a test? I mean, this is, away from vaccines even, back to illness.
Yeah, it's important to understand the incubation period is 2 days to 14 days. That means if you're exposed to the virus and it gets in your body, it's going to take 2 days to 2 weeks before you get symptoms. Now, if you test early the first couple days, there may not be enough vaccine or enough virus, rather, that the test can pick it up. So the optimal day is around day 5. If you get around the test around day 5, you're likely to get a good test. The point of care test, the rapid test, is a nice test. You can get results back in as short as 15 minutes. It's not quite as good as the viral test, the PCR test. Both are nasal swabs, but the rapid test, about 84% accurate. The nasal swab for the virus is about 98% accurate. So if you get the point of care test, you can get a false negative, meaning that it's negative, but you may still have it. So both tests are good. One has the advantage of speed, one the advantage of accuracy.
And Dr. Winter, you mentioned an exposure to illness. What is considered an exposure?
Yeah, it depends on how much you're exposed to and what period of time. So if somebody coughs or sneezes on you, particularly if you don't have a mask on, you may get it right away. Otherwise, studies have shown that at a low dose with a mask on, 15 minutes is the time. So if you're with somebody 5 or 10 minutes, maybe not. But imagine sitting down with a good friend of yours for lunch or for dinner, take off your mask, you're there for what, 45 minutes, hour and a half. If they've got it with no symptoms, you're likely to get it. So it's both the exposure time and the intensity of the virus that you come in contact with.
Okay. Dr. David Winter, thank you so much for clearing up some of our top questions. I'm sure we'll see you again next week with more.
Thank you, Sonia. Stay safe, be well.
Thank you.